I'm Dr. Masters with AccuSmart. Today I wanted to talk about colon problems, colitis, constipation, that sort of thing, anything where your colon is not working the way that it should. This particular technique works very well at helping get the nerve function flowing toward the colon, the intestinal tract. And there's a large number of different nerves that go toward your colon. So this is just part of it, but one of the most common ones is around the L3 spinal nerve. The L3 spinal nerve, and I'm going to show you how to do this on yourself. We'll have another video that's going to talk about doing this with a partner, which is, I think, actually a little more effective if you can find somebody to help you with this. But I'm going to show you how to do it on yourself here. The L3 nerve, here I've got my colon on my t-shirt. The nerve supply to this is about the level of the colon, so, which makes sense. Here is the top of the crest of the ilium. In other words, the bone that you feel here is the level of L4. If you go, I'm going to pull this up, you find this, go straight across, and that is about where L4 is, right about here. And then you go up about one level, and this is L3. Now, in general, it moves forward in the body when you have problems. It's not 100% and it can twist. There's lots of things that can happen with this, but this is in general. So you can, and if you do this, it's not going to hurt anything, so don't worry about that. You're not going to cause problems if this isn't exactly perfect. But you want to find the top of the bones, the crest of the ilium. It's the part of the pelvis. Your hips are down here. This is the top of this crest. You'll feel this ridge of bone right here. You go straight across, that's about L4, and then you go up, and that's about where L3 is. And then you get a hold of your skin, kind of like so. Get a hold of your skin here, and then you pull backwards. Give it a little pull, roll up a little bit, maybe this is L2, give it a little pull, roll down a little bit, maybe L4, give it a little pull, and this tends to pull things backward. It's a little bit difficult to do on yourself because your arms aren't in a good position for this, but that will help stimulate the nerve supply to the large and the small intestine, particularly the ileocecal and the valves of Houston. So doing that on a regular basis will really help improve colon function. So I hope this was helpful. It is something to be persistent at. It is a little bit difficult to do on yourself, so getting a partner to do this for you, your spouse or a child or somebody, an adult child or somebody who can help you with this would be great. But we'll show you a video on that here in just a minute.